Welcome back to Valley Life. I am Rich Kreps, and we are standing in the Pacific Medical Center of Hope, and I wanted to take some more of Dr. Nezami's time and also talk to some of the patients that are going through treatment right now and what they've gone through in the past and what's happening now, and a little different on this cutting-edge wave of treating cancer from a few different approaches. So, Dr. Nezami, kind of give me some background real quick, and then I want to ask Hal some questions.
Sure, absolutely. As I mentioned before, the cancer treatment has different perspectives, and one of the perspectives of treating patients with cancer is to focus on the immune system. And by boosting the immune system and changing the metabolism of cancer and manipulating the genetics of the cancer, we can augment the conventional treatments on the cancer and let the body fight with the cancer. So here we have Mr. Hal Johnson, who came here with prostate cancer. He had prostatectomy a few years ago, and unfortunately the cancer recurred after conventional treatment. He chose to proceed with the natural therapies and cutting-edge treatments, and since he has started the treatment, the PSA, which is a marker for prostate cancer, as you know, which was rising up pretty dramatically, it had stopped going up, and we have stabilized the cancer growth just by doing these treatments. So you might want to talk to him.
Absolutely. Well, Hal, you've been through this before, and then all of a sudden it started happening again. How'd you find Dr. Nezami, and then what turned you on to his style of approach of treating him?
I picked up a card at another doctor's office. That's how I found him, yes.
And that doctor just said, look, come talk to this guy. He's got some different techniques now to address this, and it seems to be working for you.
Yes, it is working for me.
Perfect.
Yeah, it's in 4 years, it's finally leveled off, and hopefully it's going to go down.
And you look happy and healthy right now, and not like you're going through such crazy treatment that is just draining you, but it looks like you're just taking this in stride, and you're attacking it from every front.
I would recommend it. My immune system has been boosted, so it's way up there, and I think it's fighting the cancer.
Well, I'm going to let you get back to the book and healing yourself, but thank you so much for your time, Hal. But Dr. Nezami, let's there's a few more on the other side. Let's kind of meander over to the other side of the building, and I love seeing these smiles.
Sure. You know, every day I am surprised by the results. I know that this is science-based and it works, but honestly, even with the knowledge that I have, I get surprised every day by such dramatic results that I see in every patient. And to the point that we have patients traveling from all over the states. I have patients from New York, Oregon, Florida, Washington, and one actually came a few weeks ago from London, England. And I can tell you that it is very exceptional that I don't see a full result in my patients. So I'm really blessed. Let's go talk to them.
That sounds fabulous. Again, you know, people can put lip service to any kind of business that they do, and they can put a percentage on it and say how well they're doing with it. When you've actually got patients that can put the proof in the pudding and say, look, this is what's happening to me, that just really sums it up for me that things are working.
Right. As you just mentioned, the beauty of these treatments is that it doesn't usually make the patient sick as it does with the chemotherapy. Okay. And so most of the conventional treatments, if they work, which rarely happens in stage 4 of the disease, the patient has to pay a big price of losing the quality of life. Versus here, the goal is to increase the quality of life and at the same time target the cancer.
Okay. Well, walk me through some of the patients here, and let's talk about some great stories that are happening.
Absolutely. So the first patient that you see here, her name is Fiona McKenzie. She came from England. Her daughters, as you see, they're really supportive of their mother's care, and we really appreciate that. So you might want to talk to them and get their own personal experience here.
So Fiona, coming all the way across the pond, as you guys like to say, we're not that sophisticated. And what brought you to Dr. Nezami?
Well, when you have stage 4 cancer and you ask your oncologist at home if he can cure you, and he says no, and various others say no, the chemo's not going to work anymore. Sure. And you ring up Dr. Nezami and he says yes. Right. It's not too difficult to figure out.
It's not that far away anymore, is it?
No.
When someone says, look, I haven't received my sentence. Let's make this happen and get back to living again, and that's what you're doing.
Yeah, we were really pleased with the initial results that we've seen in her. Her tumor marker came down from 60s to 20s. It's almost in the normal range. We're getting there. We also have seen significant results in her metastases in the brain. She had stage 4 with spread of the cancer to the brain, which has shrunk in the scans documented in the images. And also she had severe shortness of breath when she came because the cancer was also involving in the chest wall. The mass in the chest wall has almost decreased 30% in the size. The pleural effusion that she had was so significant that we had to drain her almost every week and pull out a liter of the malignant cells. That has completely been taken care of.
You know, I never want to leave this place when I come in here to the Pacific Medical Center of Hope, because Dr. Nezami is just a wealth of knowledge, and then meeting wonderful people like we just did today, it just gets you inspired to say, you know what, keep that fight going. Let's find the alternative and make it happen. Don't go anywhere. There's more Valley Life coming up right after this.